If you have breast cancer, you have a condition in which cancerous cells have invaded the breast tissue or an explosion of growth of breast cells. Although most women think of breast cancer as a lump or tumor, symptoms can differ. There may be a lump or an indentation in the skin or a discharge from the nipple. Any change in the breast should be reported to your doctor immediately, and you should always do breast exams regularly so changes can be spotted. How do you know if you are at risk for breast cancer? Many women think that the only people who get breast cancer are women who have a family history of the disease. It can be inherited, of course, but the major risk factor for getting breast cancer is not heredity, it is growing older. As women get older, their chances of developing breast cancer increase. Another risk factor for breast cancer is being exposed to estrogens for a long period of time. Estrogens are manufactured by the body naturally, but it does contribute to an increased likelihood of developing breast cancer. If you began menstruation at a relatively young age or continue having periods for longer than average, you have more exposure to estrogens. If you take estrogens as hormone replacement therapy after menopause, usually for 5 years or more, you have more exposure to estrogens. Having your first baby after age 30 or never having a baby also increases risk. Lifestyle choices also play a role in the likelihood of whether or not you will develop breast cancer. Smoking increases the chances. Eating a nutritionally sound diet reduces risk. Some folks believe that stress can also play a role in developing breast cancer. No studies have confirmed this as of yet, but the theory some physicians have is that stress lowers the body's ability to fight off anything abnormal, whether it be the common cold or some other condition. How is breast cancer detected? Regular self-examination of the breasts is important, and any abnormality should be reported to the doctor to determine if further testing is needed. Generally, the diagnostic tests are a manual exam, a mammogram, a CAT scan, an MRI, or ultrasound. All these tests look for the presence of abnormal cells in the breast. If breast cancer is detected, how is it treated? There are a number of options available for breast cancer treatment. Surgery was and is the most common form of treatment. Unlike in years past, however, surgery now is much more likely to preserve unaffected breast tissue. The complete mastectomy is often replaced by a lumpectomy that removes the abnormal cells and some of the surrounding cells. Frequently, you and your doctor may decide to add other treatments either before or after surgery. Chemotherapy, which is the use of drugs to treat cancer, can sometimes help make the tumor smaller before you go into surgery, and after surgery, it can be used to kill any cancer cells that may still be remaining after surgery. Radiation can also be used in conjunction with surgery, and because of the increased risk of cancer that is seen with increased exposure to estrogens, androgen hormones are sometimes prescribed after surgery. If you suspect breast cancer or notice any changes in the breast, remember that the best way to treat cancer is to start early, so tell your doctor right away.